Hello, my name is Dimitri. This is James, who's a surgical trainee in the UK, and Joanna is a surgical trainee from Portugal.
That's it.
So Joanna, what did you find most surprising from the RIFT study?
So as a RIFT collaborator, the most surprising finding for me was the difference between countries. So for instance, in negative appendectomy rate and use of image studies in assessment of right iliac fossa pain, there is a difference between the UK and Southern Europe, for instance.
So it was quite different. So the negative rate in the UK was 28%, I think, in young women compared to 10% in the Southern Europe.
Yeah.
Okay. And James, what about you? What did you find most surprising?
I think probably for me it was the difference in the negative appendectomy rate between young women and young men. In young women it was 28%, and in young men I think it was 12%, so over double in young women. And to me that says that there's probably something which needs to change about the pathway for how we manage patients.
And what changes do you have in mind?
Well, having reflected on the RIF paper, now I would certainly routinely risk score patients that I thought were of low risk of appendicitis to give a good, strong possibility that we can rule out appendicitis for certain patients. It's probably harder for the moderate and high risk groups. Joanna, what do you think?
Yeah, actually, you're right, because the use of the score in these medium and high risk patients is a bit more tricky. So image studies might be really helpful in this group of patients. For instance, CT scan as a routine in these patients could be an option that we might think after RIFT results.
Okay. And is risk scoring something you do in your practice normally?
Actually, the adherence to risk scoring is quite low, for instance, in Portugal, in our case, yeah.
So, and probably similar in the UK?
Yeah, I think in the whole RIF study it was something like 0.6%, so it really lowers current practice.
Okay, so probably quite a bit of future work to be done about how we can increase the uptake of risk scoring and evaluate its impact.
Yeah, and learn from country to country.
And learn from each other. Okay, well thank you very much.